Thank you. I'm really excited to be here. I'm going to take a few minutes to tell you why I think it takes a cooperative village to do the best for mankind. As my introduction said, get the right slide to go up. Oh, we've lost the slide. I was brought up to study social psychology, where we have all these theories about individuals and how they do what they want to do. So if you have a positive attitude towards something, you're more likely to do it. When I switched over to studying HIV/AIDS, things changed. And I started to realize it really does take a village, in the famous saying from Africa. They think it's from Africa. And so here are my individual models of behavior. These are very popular. They're very widely used. And these are what I was trained in back when I studied social psychology. And I still do study social psychology. But when I got to HIV/AIDS, like I said, things changed. And a few years ago, some colleagues and I put together a model of HIV risk behavior and trying to prevent HIV from spreading. And we concluded that those individual models had some problems. They're good, but they incorporate social factors indirectly at best. In other words, I might want to be safe, but someone else might make me do something I don't want to do. Right? They also largely ignore the crucial role of resources. It matters whether you have the right resource. If you can't use condoms unless you have them. You have to afford them, or someone has to give them to you. So this is the kind of stuff. Our team pursued an ecological approach to the solution. So in an ecological solution like this, you've got interacting systems. It's not just the individual. The individual is in the context of many other layers. You've got families, you've got parents, peers, you've got schools, you've got organizations, you've got whole governments that are essentially involved in behavior too. So you try to look at all of these things. Here's another depiction of the very same thing. Essentially, no man is an island, and other people are going to affect you, and what they bring to bear on you will affect you. So we developed this network individual resource model where individuals are networked with each other and they exchange resources. Okay? Both individuals and networks have needs for resources to sustain them. Unless they get those resources, they cannot keep going. Unless TED has people like you coming to these talks, TED is going to go away. This is a network. Right? And individuals, of course, if they're not sustained somehow as children, they're not going to make it in life. All of this stuff is there. There's a reciprocity between it. Individuals help networks, networks help individuals. Okay? The resources can be very positive or very negative. You can have things that are aligned in your environment that make you act badly because the resources are aligned that way, okay? In terms of your own resources or the networks. Okay? This is all involved over time and development. So we recognize that infants have different risk needs than do adolescents or older adults, whichever lifespan you have. And for that matter, networks have different lifespans where they are. TED is growing because it works so well. Okay? Preventive intervention should succeed better when the network resources are aligned to support the message. We would call that a cooperative village. Okay? On the other side, intervention should fail when the network resources are aligned against the message. That would be an antagonistic village. Okay? It's a simple idea, but past research hasn't looked at this kind of stuff. Does research support the principles of the model? Well, I'm happy to say that yes, it's true. Recently, we have published this review. What you see on here, the dots are different countries where mass media interventions have been tried and assessed. And higher values on that y-axis over there means safer. Okay? And what you have on the bottom is the development index for the nation. And what you see is that mass media interventions are not doing very well in rich nations like the US, whereas in places like Cameroon over on the left side of the graph, they're working really well. This is a great lesson that risk reduction depends on need, which our model predicts. Okay? Risk also depends on vulnerability. So in another study that we did a couple years ago, we examined the depression levels of the sample in relation to risk reduction. On this graph, safer is in the bottom part of the graph, so positive results are here. And what you see is that samples that are more depressed actually showed better risk reduction results. So more vulnerable people are responding better to, in this case, intensive psychosocial interventions to reduce risk for HIV. Whereas people who are relatively not depressed, and by the way, these samples are all women, you're not seeing any risk reduction on average there at all. Okay? The need just isn't there as much. And it also helps to highlight that different factors can be involved in HIV risk. Depression is like a resource you have. I mean, it's a negative resource for you. You get the idea. Interventions did not succeed in this study unless depression was also reduced. And so very same graph on the y-axis, that safer is better when it's down. In the samples that had greater risk reductions of depression, you saw greater risk reductions for HIV. It's as though women solving problems at home might have solved a problem for their own mental health. Or potentially, it points out that interventions are themselves a form of network. When someone comes out with a psychosocial intervention to intervene for HIV, you have people delivering messages. They're friendly. It may well be that the interventions work better simply because you had social facilitation happening, a supportive network. Okay. Now, several years ago, before I had this great insight about network individual resource model, my team and I published this very sophisticated analysis of HIV prevention. This is intensive psychosocial interventions for African Americans. And we were all proud of ourselves. It's very nerdy, one of my colleagues said. But a light bulb went off in my head about that point. And so it actually goes back in time before the NIR model. It's about when we started to develop it. It's like, we're missing something. This study looked only at things in the intervention or in terms of the samples themselves. It didn't look at anything structural. It didn't look at the context where people are living. So that was the light bulb in my head. And I thought, well, gee, interventions take place over time and space. And if I was like the good doctor in Doctor Who and had the TARDIS, I could go back in time and measure the ecology where all the studies were done. And then I could see, well, actually, it's not that hard because scientists have been doing this work for us. So essentially, we know a lot about the social environment present at a given time and place, at least in the last few decades. Surveys have been taken, they have geography in them. You know how good an environment you have in different places along many characteristics. Okay? So with enough studies, we can see how much the environment matters. It's essentially big data to the rescue. Right? So we focused on the fact that African Americans suffer great stigma in the society. We know that it varies from place to place too. Black lives matter, and you should see that showing up in our data set. So we literally went back to the same data set and added in some of these social structural factors. And this came out in about a year ago. So what we found, now you see here on the x-axis, what we've done is we've taken ratings that were gathered by the American National Election Studies, which has collected thermometers about different racial groups, racial and ethnic groups for over 50 years now. And so we were able to match these on to the counties where the individual interventions were done. And so on this graph, higher values are better to the right side, and the left is worse, so more prejudice to the left and more uplifting to the right, more supportive to the right. And then higher numbers on this one mean safer risk reduction outcomes for the studies. It confirmed a hypothesis. On average, in communities where whites do not like African Americans very much, over on the left side of this graph, those interventions failed. Okay? That's that unsupportive environment I was talking about. Whereas environments are increasingly better as you go towards more positive attitudes on behalf of whites toward blacks. Okay? This line was even sharper for adolescents, more steep, which would support a vulnerable population hypothesis. They have greater need. Okay? These effects were also bigger longer after the intervention, which is what we're theorizing is happening. The intervention ends, people go back into their environments. Does the environment support them or not? Okay. We found similar effects for residential discrimination, so people living more separate from the races are living different, more apart from each other. And to some extent, what it suggests is that intervention success depends on factors faced in the social environment after the intervention ends. Okay? And taking a more structural approach to address stigma could be valuable, not just efforts to reduce HIV risk itself. Sometimes that's just not enough. Our individual models are not enough. We need insights from other disciplines as well, not just psychology. And I'm a psychologist, so I can say that. Okay? So commonly, scholars are thought of as like filling these grand silos with knowledge. Well, in the old days, it was silage or stuff you'd feed the cows. And I grew up on a farm, so I know about these things. Silos are disappearing from the landscape. They're no longer useful. But here you've got all these disciplines, and I only had a photo with 3 silos on it. So there you've got 3 disciplines. A lot of us just sit in our little silos and accumulate knowledge for our own groups. I'd say that it's time to get rid of the silos and find a different metaphor maybe. So what I would do is say that it takes a cooperative environment, a cooperative village to facilitate those things as well. So now I've taken my network individual resource model and I've said, well, the individuals are scientists, which you see in the upper right bubble, and networks now are disciplines. Hey, those have got to work together. Use those resources, develop research that the benefits from the insights different disciplines are getting, and the result over time and development of that work will be principles that actually improve global public health. And in the end, these disciplines, and here's a sampling of health-related disciplines. I'm sorry if I omitted any. This was the best we could do. In essence, all of them have insights to add to understanding behavior, and we blend them, all the better. Thank you very much.